If you just found out that you have Ehlers-Danlos Syndrome, or you just found out that you are on the hypermobile spectrum, you have to understand a few things to get you started so you get the basics right before going on your journey. The most important thing to start you off with is you have to understand that everything you feel is real. There's no such thing as fake chronic pain. There's no such thing as fake fatigue. There's no such thing as fake depression or fake anxiety. Everything that you feel is real, and nobody that's outside of your brain, outside of your head, and outside of your body has the right to refuse that fact. By the mere fact that you are feeling it, you are experiencing it, it is real. You don't need anything else to understand whether or not it's real. Every pain you feel is real. We have imaging studies where we can actually make pain appear in the brain as it happens. And we've never once scanned a patient that has fake chronic pain. Don't let anyone take that away from you, and understand that there is no way someone can tell you that your feelings are untrue. Many times I have talked to patients that got to the point of doubting themselves and thinking there might be imposters just because of how much they've heard about being hysterical, or how much doctors told them that there is no physical reason for them to feel this. And when you start second guessing your own feelings, that's really a really tough spot to be in, and a really bad start to start it off. So maybe if you're starting off your EDS journey right now, maybe it's a good time to get some respite, breathe a bit, and think about all the times you've second guessed yourself in the past, and see if there isn't a better narrative or a better explanation to the feelings you felt in the past. Maybe EDS is part of the story, maybe it always was part of the story, but even if it's not EDS, everything you feel is real. This is not specific to EDS, but in EDS, we oftentimes feel patients second guess themselves because of how society and the medical field second guesses them. So they end up not trusting their own feelings, and that's just not a good way to start it off. Second of all, we have to understand that medicine isn't perfect, and that there isn't a single doctor, a single MD out there, a single physician that knows it all. Of course, ideally, in an utopian world, we would have an MD that totally gets you and understands every nuance about your body. But considering how little medical society still nowadays knows, even though science is moving on fast, the way medicine works nowadays is still somewhat shamanistic, even though we obviously try to get science into every part of medicine, but much of what we do is still based on beliefs and culture and traditions. If you have an MD that is willing to learn about who you are and how your body works, that's already a really good starting point, and you're already halfway there. So instead of aiming for someone that necessarily understands everything about your body and everything about your syndrome, maybe try and find someone who is willing to learn. And if you find someone that is open to you and that you connect to, maybe you can ask them if they are willing to learn. That also means that they need the humility to admit that they don't already know everything about your body. And that's already a really important step for an MD to take. So if you find someone that is capable of doing that, you should jump to the opportunity and make them your primary physician. Third of all, medical gaslighting is real. So when we as doctors don't understand what's going on, we often try to push the blame back towards the patient. And by doing that, knowingly or not, we end up gaslighting the patient. So in a recent study, 95% of all EDS patients have gotten a false psychiatric diagnosis for their EDS symptoms. So they came in with symptoms perfectly explained by EDS, some part of EDS, and they came out with a psychiatric diagnosis, and only a psychiatric diagnosis, without even realizing that they were EDS. So 95% of EDS patients will eventually get a false psychiatric diagnosis, usually an anxiety disorder. Of course, that doesn't mean that anxiety disorders, depression, and other psychiatric disorders aren't part of the experience of an EDS patient. But in terms of the medical gaslighting, the medical field is still very much inclined to explain what's going on within you through false diagnosis and not actual science. Of course, we can extend this to talk about buckets and labels and the way that medicine functions and how some of this still makes sense and how we need some of the labels and some of the buckets to make sure we get into a spot where we can treat the patient. But overall, we really are very prone to jump to conclusions and to gaslight the patient by somehow suggesting that what's going on here is just in their head and it's just anxiety. And as someone that has experienced before in the past that their symptoms are just anxiety, there is pretty much not any other medical gaslighting that feels worse than having someone dismiss your physical symptoms as anxiety, even though they've been going on for far too long and you don't feel like you're any more anxious than the MD that's actually attending you. Fourth of all, EDS runs in families, and much of what you're feeling right now is probably also going on in some capacity in someone within your family. It's a very highly inheritable disease, and it's very likely that one of your parents has a similar experience. It's not an easy decision whether or not you should go after your family and try to teach them and talk to them about EDS, but if you find that someone within your family invalidates you and invalidates what you're feeling, there's a good chance they've had this happen to them in the exact same manner and they're just perpetuating the same pattern of functioning, the same idea of, hey, I can just suggest you out of feeling what you're feeling. I can just force you not to feel any pain or fatigue or anything else that's going on within your EDS. So make sure you understand that there might be something here that's been going on for generations. If you should or not seek out the people within your family that also have EDS is a very difficult topic, and we probably have to do a whole video just on that so you can understand whether or not it's a healthy thing to do. The guidelines we usually use is to talk about your experience, and if your family member identifies with your experience because of their own interest, then that's probably the safest way to share that you feel like they might also have EDS. So being proactive about it might be a bit harder unless you know they're obviously unsafe and what they're doing isn't beneficial to them. But sharing your own experience, your own lived experience, and the conclusions you got to through your own research is pretty safe. Number 5, EDS changes everything. You need to understand that there is medication that you should never use because it might be lethal to you. You should understand that there's specific guidelines in terms of when you should have surgery, and it's different from the general population. You should understand that when something goes on in your body, your physician and you yourself should at least attempt to connect what's going on in your body to EDS and see whether or not it's related to your hypermobile spectrum disorder at base. If you do not connect the dots, and if there's anything that's going on in terms of mental or physical health that's off, that's weird, or that's unexpected, you should still try to look at it through the EDS lens. There is not a single EDS patient where you should ignore the fact that they do have EDS no matter what is going on. Of course, many EDS patients might be asymptomatic and they might not feel anything at all. But if you realize you do have EDS, and if you're treating anything that's an infection with antibiotics, that might be prohibited for you. If that's an aneurysm in your body that's at the verge of dissecting, if that's migraine, if that's anxiety, if that's endometriosis, you should try to look at this through the lens of EDS. And you should understand that your attending physician ideally should also understand that you have EDS, and then this is relevant to his care and that he should really make a point of trying to look at what's going on in your body through EDS as well. There's no ignoring your EDS. You need to look at your specific risks. Remember the fact that EDS runs in families, and much of what's going on in your body is also going on in the body of some of your family members. That also means that if there is some specific weirder offhanded disease that's going on in your family and that's kind of frequent in your family, that might be related to EDS as well, and it definitely is worth looking into it. Of course, by having EDS, you already have a somewhat higher chance of developing cardiovascular disease. That's not necessarily true for all the subtypes, but it's definitely true for the most frequent subtypes. So understanding that you have that risk will also change a bit of how to go about your cardiological risk. So the way you control for cholesterol and the way you control for diabetes should consider the fact that you are EDS, so you can ideally expand your lifespan and adjust medication, exercise, and therapy. So it's geared towards the fact that you have EDS.